Every patient has different surgical anatomy. We learn this over several years of surgical training. Most patients, the anatomy is not too variable, but we do have some patients where the anatomy can be quite a range from normal. They can have large defects, abnormal hip shapes, they can have previous surgical abnormalities. The 3D Ct Pre-Operative Planning available with the Mako robotic assisted surgery is exceptional. It allows the surgeon to identify what is exactly the right type of implant for you personally. Whether this be a hip or a knee, it allows us to choose the size of the implant that's appropriate for you. It allows us to be aware of any unusual complication or unusual anatomy that we may have to overcome during the surgical procedure. It gives the surgeon the confidence when they start the procedure that they know exactly what problems they may encounter. It allows them to know exactly what size implant they have to have available, and it makes the operation run a lot smoother. There are risks associated with any surgery, and hip and knee replacement surgery is no different. But the Mako system allows us to reduce some of those risks. Risks associated with hip replacement include dislocation and leg length discrepancy. Dislocation can be associated with position of the acetabular or socket component of the hip. If we place the socket in the correct position, this is thought to reduce the dislocation risk. Using Mako is the most accurate way of reproducing the position of the acetabular or socket component, and we would expect this to reduce the risk of dislocation in patients. In terms of leg length discrepancy, this can be quite a debilitating complication after a hip replacement. The Mako system gives us real-time position of the hip and the leg length. We are therefore able to monitor the leg length during the procedure, and before we finish the procedure, we can accurately measure this, and if any deviation or if any alterations have to be made in the leg length, it can be done prior to the end of surgery, ensuring the patient has the correct leg length at the end of the procedure. It also has the ability for us to lengthen the leg slightly or shorten the leg slightly. In my opinion, not only the leg length is important, but the offset is a measure of how tight the hip is. If we can accurately place the hip and reduce the excessive tightness in the hip, this can also help patients in their recovery. Many patients after knee replacement surgery are dissatisfied with the outcome, and the reasons for this are multifactorial. But some of the reasons include oversizing of the implants, malalignment of the implants, or a problem with soft tissue balancing. Now, the Mako system allows us to predict the size of the implant through 3D CT planning. So that should overcome the problem of an oversized implant. The malalignment, we have the most accurate system of computerized robotic cutting of the bones. And in the Mako system, compared to other robotic systems, it actually cuts the bone in 3 dimensions. In my experience of performing over 400 Mako procedures, I've noticed that my patients appear to have less pain and have a quicker recovery. Now, the reasons for this are multifactorial. We believe the way that the Mako robotic arm cuts the bone can help in reducing pain from a knee replacement. Not only do we have to reduce the amount of surgical exposure, reducing muscle cutting in the operation, but as the blade cuts through the bone, as soon as it enters the other side of the bone, the blade cuts out to reduce any damage to the soft tissues in the area of the bone cut. Now, this can make a huge difference to patients. If the blade impinges on some of the soft tissues in the knee, that can cause bleeding and also the nerve fibres in the soft tissues can give the patients pain. So we believe that the accurate cuts and the limitation of the cuts to only bone without harming soft tissues can be another factor for the improvement in pain that we see in these patients.